Getting ready to go live on Instagram as well. All right. So before we get going, positive vibes out to Mahomes. Hopes for seriously positive vibes and hopes for a realistically speedy recovery. Thorough treatment, thorough evaluation, speedy recovery. We're going to talk about how speedy that recovery could possibly be today. So we're going to use, I kind of want to use this as an example of concussion care versus concussion research. So kind of like what do we see in real life versus what we see in the books, what his recovery should probably look like, and what we'll find out what actually happens. And for many folks, this is going to be a look at kind of how athletes are treated versus how the general public is treated. Like, your CT is clean, rest until your symptoms go away. But you'll see the NFL and professional organizations actively working to get their athletes back on the field, the ice, the court, whatever. So we're going to see, see, does he play? So that's going to be kind of real life versus the books. And then I'm going to kind of explain what should have happened on the sideline, what probably did happen on the sideline, what's probably happening today and throughout the week, and why, if we see him again this week, it was a likely, I don't want to poo-poo doctors, I don't want to poo-poo his decision-making, but it's likely a poor decision medically. So jumping right in, sideline assessment. So if you saw the hit, he got taken down, his head hit. So it wasn't a direct head contact, which I saw The Athletic posting like, hey, it wasn't direct head contact. It's probably not as concussive, which is a weird thing because, it's a weird thing that The Athletic pointed out that it wasn't a direct head contact because you don't need direct head contact to have a concussion. So when Mahomes got hit, it was kind of a shoulder, kind of a body contact, but then his head hit the ground. And then it looked almost kind of like a chokehold grab, like his body, this grown-ass man's body, was dragged several feet, went into a fencing response, kind of laid there for a little bit, got up, was clumsy, so he had the loss of motor control for a second. And then the camera zooms in, you can see his eyes, he's just kind of like dazed, right? So that was a concussion. So the on-field assessment for a concussion, doctors, trainers run out there. And the idea is to just immediately, if he's still on the ground, the idea is just to check his neck. Like, how's the neck? Is there a fracture? Do we got to worry about paralysis? Do we got to worry about neuropathy? Do we got to worry about something more severe? Skull fracture. He's wearing a helmet, so we don't got to worry about necessarily, we have to worry less about something actually happening to the skull. But the idea is you run out. Do you know where you're at in space? Is your neck okay? Do we got to immobilize your neck and take you off in a stretcher? He obviously got up on his own, so that's less of a concern, but they're still checking it. Some example questions from what you're going to be asking people would be like, hey, what's your name? What's your date of birth? How old are you? What month is it? What year is it? Do you know where we're playing right now? Who scored last? Just to kind of check. And what you'll see is oftentimes people are kind of out of it. They might give you funny answers. As far as signs that he was actually concussed, we've got basically lying motionless, posturing. So you have the fencing posturing, seizure-like activity, ataxia and staggering, which he had. So he got up and he kind of lost some motor control. Head shaking, they're just kind of like, oof, like that felt weird. Bloody nose, facial lacerations, blank or vacant stare. He had the blank vacant stare. He lied motionless. He had some posturing, probably a concussion. So they went out to the field and they're like, hey, is his neck okay? Does he know where he's at? And then they pull him to the sideline. They put him in that blue tent, right? And in the tent, what happens, you run through a SCAT-5, so Sport Concussion Assessment Tool, the 5th edition. So it kind of runs through these neurocognitive tests. And I'm pulling this sideline assessment straight from the American Academy of Neurology. Dr. Kaufman from the University of Michigan. He's the Department of Neurology, so he's on the field, the on-the-field neurologist. And so I heard him speak recently through a virtual conference. And this is what they're doing. They're running the SCAT5. There's a targeted neuro exam to make sure there's no overt pathology that they're missing. And then they run through some neurocognitive assessments. They're really starting to look for, is there changes in personality? Are there changes in cognition, memory, these sorts of things? And they'll run a VOMS assessment. So on the neurocognitive side point, they might have run an impact. They might have run a newer tool that they're trialing, that Dr. Kaufman mentioned was the mules. And so if he even had one symptom, that's enough to consider concussion. If he had one symptom and a drop from his baseline, as an athlete, he probably had baseline physical and cognitive tests. So he probably had the impact was probably run before the season. The SCAT was probably run before the season. He probably had some balance testing before the season. And then they put him in that tent. They did a quick neuro exam. They asked him a bunch of questions. They asked him about his symptoms. And they probably ran some of these tests again. And if he had a flare in symptoms during VOMS, if he dropped any from his baseline and he had some symptoms, he's diagnosed with concussion. And so that's what we saw. We saw that Mahomes is out with concussion. So the next day, so that would have been yesterday, in office, you repeat the exam. You repeat everything. You want to make sure that you're confirming the diagnosis. So yesterday when we heard that Mahomes is out with concussion and he's going through the concussion protocol, they probably ran the SCAT again. It's really only useful for the first couple of days. After 72 hours, it starts to normalize, but they might have repeated the SCAT. They repeated the neuro exam to make sure nothing else showed up, because sometimes things can be a little bit delayed. And they might have even, probably not, but maybe in the NFL, I'm not sure the protocol, they might have thrown him on the bike to see his autonomic status, to see his exercise tolerance, to see how much they could push him in therapy. And so it sounds like a lot of stuff, right? And it kind of is. And so when I hear patients that have been in a car accident or have been in an injury on the field, if they're a high school athlete or they're college athlete, they're on the field and they get off. They're like, yeah, I had symptoms. Someone told me I had a concussion. So I got an MRI or a CT. They told me it was clean and I should wait until my symptoms go away. That's crazy. So what we see here is, like, in the athletic world, not only do you get the sideline assessment, but you get a repeat assessment the very next day to see what's changed, if anything's changed, and how we're going to move forward in treatment. And the treatment flow, again, according to the American Academy of Neurology, I believe it's the NCAA. I'm not sure if the NFL uses this, but it's the BRAIN protocol. So BRAIN is this acronym. BRAIN being BRAIN. So bike, run, agility in yellow, no restrictions. So basically they'll run these athletes through bike exercise tolerance, running exercise tolerance, and they'll move from bike to running because there's no vestibular stimulus in the bike. So people with dizziness, when they're running and they're going up and down or the world is moving, that can exacerbate symptoms. So they'll go bike, run, then they'll add some agility work, and then they'll put them in yellow. So a yellow penny, a yellow jersey, basically saying, hey, you can go to practice, but you're not going to go do contact drills. And then there's no restrictions. And ideally, you've done a full contact practice before you go back into game. They'll obviously add visual vestibular training, cervical manipulation, whatever's needed. This is a high-end athlete. And they're going to throw everything they can at him to get him back in a week. So before we talk about why he definitely should not come back in a week, even with all of that, I want to add kind of what I would add. What are my 2 cents on the treatment? First of all, who am I? Why would I be speaking about this? So licensed naturopathic doctor. They don't have me on the sidelines. They don't have me doing the acute stuff. But I am trained with complete concussion management. My practice is concussion. Like 98% of my practice is concussion. Trained with Garrick Institute. I am concussion specialized. I am the nerd that I once a week get emails from a journal service that lets me know kind of my top published concussion articles for the week. So it's like I'm in this world. So I would not add a ton to the assessment side, honestly. Like, we want to make sure he's okay. We want to make sure there's no overt trauma. We want to make sure that it's not worse than a concussion and there's nothing different than the concussion going on. We want to make sure, okay, it was just a concussion. I like the idea of the repeat exam. I like the idea of getting him on a treadmill early, finding his autonomic tolerance. The treatment would for sure be sub-symptom threshold exercise. I like the bike run agility flow. I would add, again, within the visual vestibular rehab with the VOMs and the neuro exam, I think, and we're getting more and more research, that you can get more targeted than that. So a lot of the research and a lot of what I'll throw with patients now is, hey, I'm going to send you home a target. It's going to be like a little checkered board thing. There's a dot in the middle, and you're going to turn your head 5 degrees. You're going to take a rest. And then you're going to turn your head 10 degrees, and you're going to take a rest. And then you're going to turn your head 20 degrees and take a rest. With that, if people aren't recovering in the first, like if they don't notice a huge change in the first week of me doing that, and again, these are people who aren't trying to play in an NFL playoff game, but if they don't improve within the week, I'm going to change it so that they're doing just like one side, just a diagonal, or they're doing head-eye movements where their head is moving separate from their eyes, different things like that. So what I'm saying is you can get unilateral with this. So rather than giving him a cookie cutter exercise that, hey, you're going to do no and yes head rotations, I'm going to say, hey, you're going to do only no to the left, and we're going to add this, and this, and you're going to be walking, or you're going to be chewing gum and talking, like that sort of thing. Stacking the therapies to ideally speed the recovery. Cervical spine, soft tissue work. I like the idea of adding visual guided therapies. I like the idea of being able to match what you're seeing with what you're feeling, because a lot of times proprioception is off. So if we want to make that happen faster, something I would add is a visual guided component. Nutrition. This is probably something that I hope his trainers and his coaches and his doctors are talking about. But his brain is undergoing massive energy deficits. At this time, it is Sunday. So he took the hit Sunday, Monday, Tuesday. Starting today, tomorrow, if he's not feeling crappy, these are probably his crappiest days coming up in the next 2 to 3 days. So Wednesday, Thursday, Friday, Wednesday, Thursday, he's looking at feeling pretty garbage. And the idea is that the reason, we'll talk about it more in a second, but the reason he's probably feeling so crappy is that you have this concussive injury. He got taken to the ground. His brain stretched a little bit. The reason he went into fencing posturing and was vacant and couldn't get up and was kind of stumbly is because his brain stretched, and there was just a spill of electrolytes. There's this spill of glutamate. Calcium was flooding into his cells, and we're going to talk about calcium in a second. And so there's just this spontaneous firing of his brain, and he didn't know where he was at. That electrolyte discharge, that calcium overload, that spontaneous firing, that excitotoxicity, that inflammation takes a long time to recover. So you've spilled these electrolytes everywhere. You've dumped calcium into the cells. You've got to get that all back to where it came from in the first place, and that takes a ton of energy. And so he's looking at this massive energy deficit that you can support with nutrition. We could have actually, if his nutrition was solid throughout the season, knowing that he's a football player, if his nutrition was solid throughout the season, his supplementation was solid throughout the season, there are supplements, magnesium, vitamin D, creatine, things that we could have, fish oil. I put an article recently on my blog about fish oil. There are things we could have done to minimize this energy deficit and to minimize the damage. And there's things after the fact that he could be doing this week to be speeding his recovery, to support the process, to make sure that the inflammation is regulated, to make sure that you're not, he's basically not overdoing the system. Because if they're trying to push him back in 7 days, it's way too fast. I almost swore there. It's way too fast in the first place. But if you're going to do it, let's at least support the system. And then sleep and stress. This dude just took a huge hit at a horrible time. Not his fault. That can be insanely stressful. Having the responsibility of this injury that wasn't your fault at probably the worst time you could have ever wanted it. So honestly, it sounds stupid, but things like meditation, paced breathing can be huge for autonomic regulation, can be huge for stress, for sleep. Sleep is disrupted after concussion. That's going to impair his performance. Coupled with subsymptom threshold exercise, paced breathing meditation can kind of rewire this autonomic nervous system so that blood flow regulation occurs quicker. Cool. So going through all that, he had a way better assessment than most of the general public. Hopefully, he's getting way better reevaluation and treatment than the general public, hopefully, which is a bummer. What I would add is a little bit more nuance and specificity. Hopefully, he's getting that. I would probably add a lot more nutrition than he's getting. Hopefully he's getting that. Why returning in 7 days is silly, to put it lightly. So what I was just talking about, the metabolism of concussion. It doesn't matter. Concussion doesn't care if you're a football player, if you're an old lady in a car accident, if you're a youth hockey player, it doesn't care. If you've had a concussion, there's a pathophysiology behind it, right? So part of concussion is this metabolic part. So part of concussion is this like whiplash injury. And as you do that, your brain stretches. It doesn't stretch enough to tear. It doesn't stretch enough to bruise or bleed, right? That would be not a concussion. We would see that on MRI or CT. The reason it's a concussion is because he had this brief loss of brief disorientation of consciousness. He had normal imaging. Probably is dealing with some symptoms. He definitely had a normal Glasgow coma score, 13 to 15. And so he had a concussion. It doesn't matter if you're Patrick Mahomes or if you're Tiny Tim on the ice rink. Your brain stretches, not enough to tear. Electrolytes go everywhere. Calcium floods the cell, and when it floods the cell, it floods the mitochondria, and that's where all the ATP and energy is made. It's really hard to get calcium out. Once it's in, it has this affinity for the mitochondria, and it clusters and it slows down energy metabolism. So your brain goes stretch, electrolytes go everywhere, calcium goes here, your brain goes, we got to put all that back. And that takes a ton of energy. It takes, if you high school biology throwback, the sodium potassium pump, trying to put potassium, calcium, chloride, like all that stuff back where it's supposed to go. Calcium's a little bit slow, and mitochondria are a little bit slower, so you don't have as much aerobic energy. You're relying on anaerobic metabolism. So your brain is actually like 9 times less efficient than it would be pre-concussion. And simultaneously, the reason we give you exercise, the reason we give you paced breathing is we got to rehab your autonomics. You've got decreased blood flow to your brain. Animal studies, if Patrick Mahomes was an animal, he's got up to 50% less blood going to his brain than before the concussion. And it varies. He might have more blood going to some areas, less going to others. It kind of shifts back. Like, it's not super consistent, but we know that blood flow is dysregulated. We know that his brain is not getting a steady stream of blood flow, which impairs his mitochondria's ability to make more ATP, right? So if you look at a graph of concussion, I've got this on my website, I've got it on my Instagram, you'll have energy levels up here, and then in days 3 to 5, you'll see the energy levels dip. And brain energy levels after a mild TBI dip by like 20%. And so you dip, and it takes 21 to 30 days, 22 to 30 days before your brain metabolism is better. That's not a week. That's not 7 days. So it takes 21 to 22 to 30 days before brain metabolism is back up to what it was before the concussion. Days 3 to 5, typically symptoms peak because energy levels are their lowest. Days 7 to 10, symptoms go away, but it doesn't correlate with energy levels. Crisscross, right? It kind of sucks because you'll feel better, but your brain metabolism isn't up to par. So he's going to feel pretty crappy, probably again, he probably feels not so great now. He's probably going to feel his worst tomorrow, Thursday, maybe into Friday. And then he's going to start to feel better, and he probably will feel better by Sunday. And so if it's this like game time decision, how does Mahomes feel? He's probably going to feel better on Sunday. He probably will feel better. The problem with that is that your energy deficit is your worst 3 to 5 days, along with symptoms. Energy deficit lasts another 21 to 30 days. So when we look at animal studies, because we can't like purposely concuss humans, but when we look at animal studies, we'll give them repeat concussions at different times. And over and over and over again, when we look at animal studies, repeat concussions too close together. So 3 days, 5 days is kind of the animal time period. But if you matched up animals to humans, a 3-day repeat concussion would kind of be like a 7 to 10 day repeat concussion in a human. If you put them too close together, the compound effects of 2 mild TBIs, 2 concussions close together, is equal to the energy deficit of a severe TBI. So you're looking at a 20% drop in a TBI, you're looking at like a 50% drop in a severe TBI. So concussion, 20% drop, severe TBI, 50% drop. Repeat concussions will match that 50% drop. So you're looking at a significant injury should he repeat his injury. In human case studies, when we just looked at, okay, did these people go back to sport? Did these people get a repeat concussion? And the folks who went back to sport and got a repeat concussion, the folks who went back sooner and got their repeat concussion sooner, took way longer. We're talking like months to recover. We're talking, I think the lowest I saw was like 3 months to recover after the second concussion. And so he's looking at, like, when you're looking at the kind of the long-term trajectory of like risk of second impact syndrome, which is fatal, the risk of if you don't look at the fatal side of second impact syndrome, just the risk of a second concussion that is that severe, you're looking at a much longer, much more severe recovery. You're looking at, it's going to be shitty, just plain and simple. The other thing to consider is that not only is potentially his exercise tolerance is disrupted, you hope that he's an elite athlete getting his recovery back, getting exercise tolerance back to his at least a steady state, to what he can do. But you're looking at a decreased reaction time after concussion for 21 to 59 days. So 3 weeks to, 3 months, 60 days, 2 months. Doing my math here, 60 days, 2 months. So you're looking at 3 weeks to 2 months of a decreased reaction time. And you're looking at trying to play again in 7 days when your brain energy metabolism is still low, when your reaction time is low, when your risk of repeat injury is higher because your reaction time is low, your exercise tolerance is off, blood flow regulation is different, and that repeat injury is at risk of being more severe because your brain energy levels are a lot lower, and we've got evidence that repeat concussion in too short of a time frame is just bad for the brain. It's not cool. So what's a guy to do? I honestly, this sucks because I was an athlete. I was a hockey player. I had concussions. I played when I shouldn't have played. And there was nothing like a Super Bowl on the line for me. Like, it was club college hockey. I was in the ACHA. Like, I wasn't going to the show. There was no Stanley Cup. There's no rings on the line. And I still played. So but medically, thinking of his future in the NFL, future after football, just life with family and kids, and what we know and what we don't know about CTE, I say don't play this week. Easy for me to say, just chilling here from my home office. But as an athlete, somebody who's worked their whole life for these opportunities, I can definitely see the conflict. Time will tell with what he does. That was mostly, I had to rant a little bit. The whole IG Live this week was just kind of a rant, a little bit irked by the Athletic article that was like, well, he didn't even get hit in the head, but he had fencing, posturing, and some of the symptoms of concussion. And most athletes don't return in 7 days, but it is possible. Tell me how it's possible. It's possible when people skirt the system, when people don't actually go through the process. So again, sideline assessment. If you're wondering what concussion care could look like for you, because this is what it looks like for athletes, after the injury, if people are there on the field, they're looking at your neck, where even if you're not on the field, if you're coming in after a car accident, if you're coming in after a fall, after an injury on the field in youth sports and adult sports, we're going to run through your symptoms. We're going to do a neuro exam to make sure nothing focally is wrong. We're gonna do concussion specific exams like the VOMs, maybe the best posture balance scoring, and then we're gonna eventually, within the first 5 to 7 days, throw you on the treadmill. So again, think about it. He's potentially playing in 5 to 7 days. We'll typically throw a patient on the treadmill to test their exercise tolerance in 5 to 7 days. When you're looking at return to play, like some of the studies with return to play, most athletes don't return for 39 to 59 days. You're looking at least a month, maybe more. If you're going hard at this, he could return in a month, 3 weeks, 4 weeks, but 1 week, crazy. So go through that exam, and then yes, there are treatments. So if you're someone who has gone through concussion and your doctor was like, well, you have the symptoms, just rest until they go away, or your CT is clean, just rest until they go away. Maybe you can be like, dude, treat me like I'm Patrick Mahomes, because the treatment flow is going to be sub-symptom threshold exercise, visual vestibular rehab, cervical rehab, making sure that if it's a car accident, if it was, God forbid, it was domestic abuse, if there's psychological trauma associated with this, we're going to get you referred to the right mental health professional. So it is far more involved, integrative, and requires a lot out of you as the patient, but it's a lot more aggressive than rest until your symptoms go away. I think I've said everything I want to say. I've got a question here. So minus the risk of injury or death, do you think Mahomes' post-concussion performance is greater than the second QB for winning a Super Bowl? This is interesting. Hard to tell. Super hard to tell. part of it is because the injury is going to be so unique to the person. So we've got profiles of concussion. So within the concussion profiles, we've got cognitive fatigue, anxiety, mood, ocular, vestibular, and migraine. Sometimes people are saying there's a sleep, a cervical spine. There might be, it's kind of up in the air, but those are the 5, depending on which symptoms he's experiencing the most. So some people come out and they feel mostly physical symptoms. Some people come out and feel mostly cognitive symptoms. Some people come out and feel mostly vestibular. So depending on where his deficits lie, like if he's really struggling with like an ocular, vestibular type concussion, like his performance is going to suck. His ability to move his head is going to be restricted because his body's just going to be protecting him. Your vestibular system is kind of telling you where you're at in space. So you'll see like one of the signs, like if you watch, this is no offense, but if you watch someone elderly in a grocery store, when they turn their head, like if they're, like little Granny Sue is walking through the grocery store with the cart and her husband Tom comes by and is like, hey, do we need carrots? She's going to turn around and she's not going to be like, oh yeah, we're fine, because that's an intact vestibular system. She's going to turn like this. Well, we'll see that after concussion, or if people don't feel, like their vestibular system's intact, they're going to rotate like this. So his posturing is going to change. The way his reaction time is going to be different. The way he orients in space is going to be different. If his eyes can't track the ball, his eyes aren't going to be able to track his receivers. There's a lot that could go on here. He is a professional athlete. Professional athletes are different humans. They're just different than us. They really are. Their performance levels, they're like, Dr. Connor Ryan, physical therapist for the Arizona Coyotes, works across the hall from me. And he talks to his athletes about picking the pepper out of the salt shaker. Like you or me walk in and like we've got problems after a concussion. Professional athlete walks in and they've got like problems, but they're also performing better than most people would anyway. So it's really hard to tell. His game will be different. I can predict. Cover 3, we're rooting for Patrick. I'm rooting for Patrick too. Like I hope this guy, like again, if he's back in 7 days, I hope it's because he's an animal and his brain is ready and he's not at risk of another injury and he doesn't get another injury. But yeah, so hopefully that was coherent. Were there any other questions? Yeah, treat me like I'm Patrick Mahomes. Yeah, seriously, I'm serious. If doctors are just not as educated on concussion as they should be, studies show it's anywhere from 20 minutes to 2 hours in concussion education. If you've watched even a couple, 3, 4 of my Instagram lives, you've sat through more concussion verbiage than most doctors. So that's just unfortunate. So yeah, ask your doctors, treat me like I'm Patrick Mahomes. There are therapies, again, subsymptom threshold exercise, visual vestibular therapy, cervical rehab, being able to work on proprioceptive stuff, being able to work on psychological trauma. It's all important. It all matters. Nutrition is huge. It's largely underlooked. It's a lot of what I like to talk about. Yeah. So thank you all for joining. Why do you think some people get long-time effects of concussion? So there's a lot to that question. So persistent post-concussion symptoms. You're looking at kind of predisposing factors. So women, for whatever reason, it could be a drop in progesterone. It could be changes in the proteins within the neurons between men and women. Could be neck reactivity, stability, different things play into. Women tend to get more prolonged concussion symptoms. Folks with history of multiple concussions might have persistent symptoms if they're not recovering as fast. I've seen a couple studies question this, but previous like learning disorder like ADD, ADHD, previous anxiety, depression, PTSD prior to the concussion, headache disorder prior to the concussion. So there's different predisposing factors that can lead to a longer effect. One of the biggest factors that's showing up in the research, Dr. Cameron Marshall from CCMI actually is predicting that this is going to be a part of the next general concussion consensus statement. So the Berlin consensus was supposed to be re-evaluated and upped this year, but COVID messed that up. So I think they're pushing it off another year. But time to treatment, time to evaluation and treatment. So we've got research that in youth athletes, if you were evaluated within 4 days, your recovery was like months faster than if you were evaluated in 8 days. I got a post on that on my websites, or my blog and my website somewhere, blog, Instagram. So basically time to treatment some predisposing factors: female learning disorders, previous concussion, headache disorder, anxiety, depression, things like that. Time to treatment, which I already said, and then the type of treatment. So active treatments versus rest. So if you just got evaluated and then you're like, oh, cool, I got evaluated, I got into my doctor in less than 4 days, and they were like, hey, buddy, rest. That's kind of a risk factor. Prolonged rest. Part of the reason exercise is so beneficial is because you get these CO2 tolerance, you get this autonomic balance, you get this blood flow to your brain, you get autonomic balance, HRV improvement. Part of not exercising is you get the opposite of all that. You decondition, and deconditioning is a risk for kind of prolonged concussion symptoms. Deconditioning is a risk for POTS, dysautonomia. So there's a lot that goes into who's going to have persistent symptoms, and it's probably not going to be a guy like Patrick Mahomes. There's too much on the line for him, and too many people around him. I assume he's getting therapies, kind of like we talked about. Have you heard about the new research at Brown University regarding sensing tech for under the helmets? Yeah, and the question around that is going to be helmet fit. And then in terms of what I've seen, I haven't looked at the Brown U, but a lot of helmets just check linear acceleration. They can't detect rotational acceleration. And I heard there's some research going into that. So that might be what they're doing at Brown U. But yeah, so a lot of helmets are just looking at linear acceleration. That's kind of where we get the data that, like, for a concussion to occur, you need it to be at least 60 to 80 Gs of force, up to like 100, 120, 160 Gs of force. That's kind of concussion range. But again, that's just linear acceleration, doesn't count for like the rotational component. And the rotational component is kind of what gives us the autonomic dysfunction. So now that a lot of people are joining, I'm actually done rambling. I will post this up so you guys can hear my rant, and we can chat about it in the comments later. But I've actually got to start getting ready for patients. So thank you for everyone joining. I wish the best for Patrick Mahomes. For folks who are not NFL professional athletes, college athletes, watch this video, show it to your doctor, be like, hey, look, treat me like Patrick Mahomes. Do not be satisfied with a doctor saying, hey, your CT is clean, go home and rest. Cool. So thank you. I appreciate all of you. Have a good rest of your week.